Welcome, everybody, once again to Hearing Health Insights with iCAN, where we bring you exclusive interviews with independent audiologists in South Africa. Our goal is to help the public understand more about hearing health and the professionals who play a crucial role in it. And today I'm very excited to introduce Dr. Natalie Buttress, a colleague and friend in Cape Town who has run a couple of successful practices over many years, and it is such a privilege to talk to Natalie today and to pick her brain about hearing healthcare in South Africa. Welcome, Dr. Buttress.
Thank you so much, Cara. It's really lovely to be here and to share a forum with you where we can chat openly about our passion, really, isn't it?
It is, and I will struggle to find a platform which shows two more passionate audiologists. I will really, really struggle. So I'm going to start off by asking Natalie, because we recently had a symposium and had some very interesting questions from the public. And I think that these questions are probably burning questions from many of our patients. And the question went by the following. They said, Cara, can you tell me what you're doing in your own capacity to make sure that we are trying to do whatever we can to bring down the high costs of hearing aids? What are we doing to make sure that the rest of the public are educated and aware of the different hearing aids that are available? And how do we make sure that our patients are making educated decisions? Because as we know, but the public doesn't know, that all hearing aids are not created equally. So I just wanted to know from you, Natalie, what is it that you're doing in your professional and personal capacity to make sure that we can access more and more people with hearing challenges?
What a great question. And I'm sure one of the burning ones of, uppermost to all of us who are seeking healthcare of one kind or another, because the cost of healthcare is substantial. So firstly, let me just say that I think accessibility for all people for healthcare needs is a human right. And I think that any professional in any field where the delivery of healthcare services matters to them should be striving towards the best outcome, the best value of function for their patients, or outcome of a cure or whatever it might be, against the cost of the services and the route there. But unfortunately, very often these things are in an ethical tug of war with each other, because low cost sometimes means very basic servicing, whereas sometimes higher costs actually get a better quality outcome. So it's always something that we should be mindful of keeping in balance. For me, what do I do? Firstly, to some degree, separate my services, which we never want to minimize to the bare bones, because services by a professional are something that are driven by the education, the training, the skill set of that professional. And we want to deliver the best practices to our patients so that we know that we're achieving the outcome with whatever tools we're using. So I have some level of separation between the services I provide and then the tools that we use to get there. And you're 100% right, there's a scale of different tools available. Ultimately, we want to try and educate our patients to make selections for themselves by ensuring that they understand why we're making certain choices with them. So being able to look at a patient's hearing loss in isolation isn't enough. We need to look at the hearing loss in interaction with their environments, their lifestyles, their other healthcare needs, whether they have other modality limitations or restrictions. And the more we share to educate our patients about the parameters that we are using to make those decisions, the more well-informed a patient will be, and therefore hopefully make a good value choice, not necessarily the most expensive, not necessarily the cheapest, the right one for them, for what they need for their lifestyles. Of course, I participate in the iCAN because we want to keep the value of those services and skills high, but we also want the group power that the independents are using together to help drive some of the costs of the tools down wherever we can, while still respecting the fact that our manufacturers have got costs to support our patients. You know, they've got laboratories, they've got staff, they've got rent. So we have to be respectful of the fact that we'll never get those right down to a zero. One other thing that I think is extremely important is to help our patients through our counseling, through our support, to overcome the stigma of having a hearing loss. Because I think that the legacy of hearing aids worldwide is that they used to be, the first hearing aid you could actually wheel around on a trolley, and it had wires up to the person's ears. So of course they've evolved enormously, but even when I first started fitting hearing aids, I qualified in 1993. So I started fitting hearing aids as a student in 1991, and obviously in practice in 1994. And even then, hearing aids were much larger, much more visible. And I asked myself, have we achieved the holy grail by making hearing aids invisible because people like to not have their hearing loss apparent to others immediately? Or is the greater achievement the removal of stigma that if I have a hearing loss, I'll wear a hearing aid and I'll be bold and proud about it? And why do I say that that will drive down the costs? Well, because the research and development costs of creating that hearing aid is on the one end, and the number of people that wear hearing aids is on the other end. So if we can remove stigma, and if everybody who has a hearing loss will go and have a hearing aid fitted, then the gains for the manufacturers to ensure that they can cover their costs on R&D are overcome at a much cheaper price. So I think that those are all the things I'm doing: reaching the public, educating my individual patients, stimulating the loss of stigma for hearing loss. And if I ever have, and I know I will because I have a family history, when I do, I'm going to wear the brightest, most obvious hearing aids I can possibly wear so that everyone asks me, what are you wearing? And I can tell them. And I think that, obviously you don't want to push your patients to feel obligated to be trendsetters, but I do hope that younger people with hearing loss can be bold about it and forward about it and enjoy their products in a way that can educate others. So that's, I think, what our role is.
What a brilliant role you have, and a wonderful outlook on just life in general. And it's the truth. It's the truth in that if more and more people were comfortable with explaining to others why they're wearing a device and what they need it for, I think the better it will be. And having said that, are you noticing that there is now a trend for younger people to come in earlier, or are you still seeing that people are waiting between 7 and 10 years to treat their hearing loss?
Well, I think there's a split, because I think that if there are some folk who are still carrying the mindset that hearing loss is about becoming older, which, really our longevity has changed. We live much longer than we used to, and it's completely natural that many of our faculties change as we move into older age. So of course, along with all the gains of wisdom come things like hearing loss and changes to eyesight. And so I think it's going to be difficult to completely disconnect hearing loss with being older, in the sense that that's a norm. It's a norm for the over 60 population to have some amount of hearing loss. But I also think that because hearing aids are now capable of so much more, like every other device in our milieu of devices available to us, they've become integrated. They can, Bluetooth to computers, music, phones, etc. So they've become integrated objects in terms of using them for hearing loss and other pleasures, entertainment, for example. And they've also grown in healthable tracking. So, step movement and heart rate. And I think we're going to see more and more of the integrations of overall health and entertainment function and live hearing capacity in these tiny little, very sophisticated computer devices that we're wearing on our ears. And I think because of that, there is certainly an uptake in a generation that understands the kind of geekiness of enjoying technology. And I love the fact that hearing aids are no longer just seen as a device to make sound louder, but actually are refined devices that can make sound clearer, in most situations benefit people in noisy conditions, and then on top of it, be an interface between all of the gadgets that we use so that they can make us hands-free and capable of doing multiple tasks at the same time. So I think there is the nutshell answer is I think there is a better uptake in younger people, and more I think that if you see younger people in your practice and they become happier and bolder with their hearing aids, they actually influence their own generation to be more comfortable, and we change the face of hearing technology and the way it's perceived a generation at a time.
It is. It's amazing what these little computers are really capable of doing nowadays. And a lot of people in the public, in the general public, don't even know what those capabilities are. So thank you for sharing all of those technological changes and updates with us about hearing aids. I wanted to ask you one last question, because I've looked up to you as a professional, as a practice owner for many, many years. And also now that we're both involved in iCAN, we are meeting a lot of younger professionals that are feeling bold enough to open up their own practices. Could I ask you, if you were talking to your 20-something-year-old self, I know it's only a couple of months ago, but if you were talking to your 20-year-old self starting to open a practice, what advice would you give to a young, new, sprouting practitioner who sees her or his legacy as being a hearing healthcare business owner?
Such a great question. So I think probably the primary thing that I would say is invest in the relationships, both with your patients and your colleagues. There's probably nothing that evolves your practice more than the word of mouth of feeling cared for. It's not about whether you get every single job done perfectly. It's about whether the person across the table from you feels like you are invested in their outcome. So I think that your relationships with your patients are absolutely paramount. And because of that, I would advise you to take longer with your patients. I have a philosophy in my practice that we will never be a sausage turning out of patients in and out the door as quickly as we can for as quick a buck as possible. I never want to see dollar signs on my patients' faces or heads. I want to see each individual. I want to get to know them and their lives and what they need from me. And I want them to feel that care, and to feel that you have to give time. It's probably the most important commodity in your practice life, is how you allocate your time for your patients. And I believe that a little bit more is not, you might think that it's the quicker way to better business, but it's exactly the opposite. Your investment with your patients, with the time that you take with them, will create better outcomes, and the better outcomes will create better word of mouth, and that will grow your referral base. So from a point of how you build a business from the ground up, your patient is the most important thing in your life, in every single day. And the second most important thing in your life is your administrators. Teach your administrators to care about your patients as much as you do. And again, they may make mistakes. I mean, we're all human, and we do. So, you might, get a number wrong, get an account wrong, put the patient on the wrong day. But if the patient knows that your admin cares about them, if they get welcomed into your practice with happiness and care, they will feel that sense of belonging. And that is part of creating an atmosphere of good healthcare in your business. Then I would say invest some time in getting to know not only your colleagues that are further away and you respect and love, etc., but even the colleagues down the road from you. Yes, maybe we are in competition with each other, but we are all in the same profession for the same reason, and that is to take care of people and grow their healthcare in hearing or balance. And so being able to be warm and communicative and friendly and interdependent with the colleagues around you will also create a better atmosphere for the environment that you practice in. And then don't forget to understand your business. And I think that if you are an audiologist and a healthcare practitioner, so you're a clinician, you didn't do a degree in business. So surround yourself with people that are trustworthy, who understand running a business, who understand your accounts, who can advise you on legal, but don't hand over the task to them. Be involved in it. Sit, especially at the beginning, sit with them and learn about it so that you have a fundamental, foundational understanding of what it all means. And then if later on you become really busy and you have to actually direct those tasks to these other specialists in their areas, then you can look at sets of figures and you can look at the feedback that you're getting from what your business is doing, and you'll understand it without having to be involved in the steps. But in the beginning, it's actually worth sitting in and asking your accountant or your lawyer questions. Why do you do it this way? And what does it mean if I do it that way? And then the last thing is understanding what legislation requires of you. So through your professional associations, through the HPCSA, learn what your regulations are, learn what you're required to register for within the government, etc., and make sure that you've got all your structures in place, because there's nothing worse than running a really wonderful practice, looking after your patients, having a great face to your practice, but actually, because you're not legally compliant, if you are audited at some point, you can come apart at the seams. It can become very threatening in that situation. So I think those are the steps I would take, the things that I would look back. And don't be afraid to be you, probably, is my very last thing. No one wants to see a person who doesn't have their own personality. So in your practice and within the professional boundaries, be who you are, because authenticity is probably the most important thing we can seek from other human beings.
And such a fabulous load of suggestions and tips and tools. And you're 100% right in that you have to remember, if you're a new young practitioner, there's actually no competition, because no one can compete with your space, and you are your own individual. And so how can anyone compete with that? And it is okay for other people of the public to either resonate with you and your personality or not. And we don't have to please everyone. So I think that's also a learning curve that happens over time when you realize that you're not always everyone's cup of tea, and the same applies the other way around. Well, I want to say thank you so much for your time. I know it's valuable and precious, and I wanted to also say thank you for your additional time that you put in behind closed doors and that the public never sees on everything that you do for the profession of audiology, both outward and inward. And we are the luckiest people within the profession to have someone like you that advocates for the patients, the public, as well as the rest of our colleagues. So thank you very much for your time and your keen sense of passion for this profession.
Thank you so very much, Cara. Thank you for having me on your show.